Okay. So we'll just wait a few minutes and just see who's going to be joining. I'm going to go on live here so we can see who's coming to say hello. So I shall just do that. Hopefully.
You are.
Here we are.
Yep, you're good.
Hi everybody.
Hello.
So we've got a few people that have joined us already. I'm seeing myself in two places now. Dawn Collender, hello.
Hi Dawn.
Okay, so I'll just keep an eye here. Hi Nee from Madrid.
Oh, hi.
So as you can see, we're back in our lovely clinic today. At a distance, obviously, but it's so good to be back, isn't it?
It really is, it is, and we are so excited for next week.
I don't think I'll sleep
No.
Tuesday night.
No.
Just so much to think about as well. Hi Helen. Helen Moore's giving us a wave.
Hi Helen.
Oh, I'm not liking seeing myself. I normally do this.
Oh, Amy, you
Like-
did a sterling job.
To see myself.
Amy is the queen of the Facebook Lives.
No. Okay, so we've got a few people joining us, so we can make some. You're going to save this to your Facebook page anyway, aren't you? So that people can look back and watch it from the start. So we'll not babble on too much at the very beginning, so we'll bore everybody that's going to watch it back.
Yeah, absolutely. Yes, yeah.
So I'll just let you say what we're doing this evening.
Okay, so here we are, social distanced. I think most people who come to the clinic know Amy, who is our beauty therapist in room 2. So Amy's already had some questions around the treatment we're going to talk about tonight. So she's going to put those out on the floor first of all, and then really we're open to any questions that anybody's got, so please feel free to fire away. Amy's going to keep an eye on what's happening so that she can put the questions forward. But yeah, so first of all we're just going to introduce our new treatment, which I'm absolutely ultra excited about, and it's a treatment called Morpheus Aid. I've had a lot of people contacting me regarding this already. We've been doing quite a bit of work on our social media around Morpheus Aid, the potential goals that you can achieve with Morpheus Aid, the way that it can help with facial rejuvenation. So I am aware that some people know something about Morpheus Aid, but really what I want to talk to you today about is Morpheus Aid, what it is and what the treatment is. So in a nutshell, Morpheus 8 is a radio frequency fractional skin needling treatment. It's a treatment you may have seen recently in the press. It's been pretty high profile with Judy Murray. So we've seen at the beginning of the year Judy's pictures from last year. Incidentally, she was an Abargy patient as well and had fantastic results from that. But Judy, over a course of, she had the 3 treatments. So when you start a treatment with Morpheus 8, the recommended treatment is 3 treatments over a period of 3 months. And basically what this treatment is, it's dependent on where you have the treatment, because you can have it anywhere on the body, including the face. We see a lot of facial treatments with Morpheus 8. But basically what it is skin needling with a radio frequency pulse that's going through. So it's unique. It is a very unique treatment. There's nothing on the UK market similar to this. But basically what this does is it stimulates collagen in a really ultra kind of fashion. It also, which is the unique angle of this treatment, because of the levels that it can reach to, it actually can coagulate the fatty areas. So for example, as we age, one of the issues that comes along with ageing is that we get these jowls and we get little pockets of fat under the chin. And there isn't really anything else out there that can deal with this other than surgical options, as well as the Morpheus 8 can. So basically what the Morpheus 8 does, because of the levels that it reaches to, is it actually gets into the fat layer, coagulating the fat, tightening the fat. So what you see, and you've probably seen on my Facebook page and on my Instagram, is that things like the double chins start to disappear, these jowls start to disappear, and as there's lots of added benefits to the Morpheus 8. As well as doing that, it also stimulates the collagen, it helps to resurface the skin, it also helps to make the collagen work a lot harder, and that's certainly from the age of 40 onwards. We all need treatments that help our collagen to work a bit harder for us. So in a nutshell, that's the Morpheus 8. You can tell I'm passionate.
In a nutshell.
I love it.
It is absolutely amazing, and we've been looking here, like, just sending emails, pictures back and forth of just the results from the Instagram, and absolutely amazing. I'm excited to see your patients coming through the door, and then just watching their journey unfold as well, because it's just going to be amazing, isn't it?
Yeah, absolutely. The results are beyond what I've seen with any other platform, and I had, prior to becoming involved with InMode, I did look at other platforms, but for me at the clinic, quality is always at the top of my agenda, and I could have purchased other platforms, but the InMode platform, it, in my opinion, is the best on the market, and I only want the best for my patients, and here it is.
And Nancy's just joined us, so I'm sure she'll be. Hi, Nancy. So what is Morpheus? So you have just answered some of that for us.
Yeah.
So I've got a couple of questions that have just been sent in to us since our clients, your patients, have been seeing this on social media. So why Morpheus 8, and why bring that to the clinic at this time?
So for me, as I've already said, the results that you achieve with Morpheus 8 are greater than any other device that I have seen on the market. I would say the majority of my patients are probably in the 40s, 50s, 60s, and commonly they come to me complaining of the signs of ageing that we all see, and I certainly at the age of nearly 53 have these signs. I have had Morpheus 8, I've had my third treatment of Morpheus 8, and I can see the results in my face. So you know, the common signs of ageing are the jowls. We see the under eye area becoming deeper. We see problems with lines under the eyes. We start to see these, sometimes people have these festoons, which are almost like little saddlebags of fat. As far as I'm aware, on the aesthetic market, if we're looking at non-surgical devices, there isn't actually anything comparable to Morpheus 8 that can treat these issues. We just need to look at the evidence around Morpheus 8 and look at the befores and afters to see that it actually is able to deal with these problems in a really efficient way. So I think everybody who sees me, who knows me, will know that my essence isn't around fake looking aesthetics. What I like is a really natural approach to aesthetics, and I will only ever invest in something that will support that kind of approach to aesthetics. The Morpheus 8, it ticks all of the boxes for me, because it just helps to not completely change the way you look, but it will help to address those signs of ageing that we all experience, and it's just so effective. For me personally, one of my main problems was around my jawline, and it was these little deputy dog pouches that were appearing. Now, what the Morpheus 8 does is, because it can penetrate down to the fat layer, it actually coagulates the fat, so giving you a much firmer jawline, and I suppose ultimately the treatments that I provide to people are treatments that make people feel better about themselves. You know, the thing that I'm seeing time and time again over the past year, whether it's here or within general practice, is that people are feeling miserable. you know, they're feeling life has changed completely. People are spending a lot of time. Life's become much more insular, and they're spending a lot of time looking at themselves on Zoom and seeing. And Zoom is never flattering in best will in the world. Even for, I'm sure even Kim Kardashian will look at Zoom and think, "Oh my God, what's happening?" She's a Morpheus 8 user, by the way. But Zoom isn't flattering. But it I suppose, helps us to look at ourselves and think, oh my God, these are the signs of ageing that are taking place in our face. And Morpheus 8 can really help to address those signs and to refresh and make you look the best version of yourself.
I think it's working because Emma, our lovely Emma Laughlin, has just said you look amazing.
Oh,
so clearly on camera it is doing the job. Yeah. You do look amazing. So.
Thank you so much. It helps. It really helps because it tightens. It helps with the jowls. It helps with this is called this submental pouch just under here, which is such a common problem for certainly for women in their 50s. It just really helps to tighten that back up again. So yeah, I can tell a huge difference in my face from having the Morpheus 8 treatments. And interestingly, the results of Morpheus 8, you will start to see results probably around 2 to 4 weeks, but the results that continue for your real results start to come through around 3 to 6 months after your treatments. The treatment pattern, as I've already mentioned, is 1 treatment a month for 3 months, and then after that it's a 1 treatment per year maintenance. So you know, in terms of investment, it is a good investment for your face if you're wanting to see those changes and to feel fresh.
I'm just picking up some questions here, which I think actually some of the questions that came in early on you've probably already answered. So we had Helen Moore actually has asked a couple of questions. Is it permanent? So I think you've just answered that, and you've just talked about the results of that.
Yeah. So you do need to carry out the maintenance regime, Helen, to maintain your results. Certainly, if we are referring to Judy Murray, who, as I've already said, has been in the press a lot over the past year. Over the past beginning of this year. As far as I'm aware, her treatment regime was a Bargy Nuderm, which is something that I specialise in, and the Morpheus Aid on the standard regime. So I think she had the 3 treatments, and she will go on to an annual maintenance treatment. There are lots of other things in the clinic that we can do in between times, but in terms of Morpheus Aid, that's all you really need to do to maintain it.
Okay. I'm just going to ask you about another question that Helen's just asked as well. So on a sort of discomfort scale, how comfortable is it to have the treatment?
Okay, so in terms of discomfort, obviously a lot of the treatments that I perform have a certain level of discomfort. It is really dependent on your own personal perception of pain, but I was listening to I was involved in a Zoom conference yesterday with InMode, and one of the doctors that has recently introduced InMode into his clinic has already audited his patients and their perception of the discomfort associated with this treatment. And he had said that on a pain scale, commonly in medicine we use a pain scale which is 1 to 10, so 1 being absolutely no pain whatsoever, 10 being having your arm chopped off. And most of his patients had said that the discomfort level was around a 4 to 5. The treatment itself, before you have the treatment, you have an application of a strong topical local anaesthetic, and you sit in clinic for 45 minutes. So you have got that local anaesthetic effect, but the treatment itself is fairly quick. There are certain areas of the face that feel a little bit more uncomfortable than others when they're being treated, but personally, having had the treatment, I would say it's completely tolerable, and for the results that you get, well worth those moments of discomfort.
No pain, no gain.
No pain, no gain.
I love going into that room. What else have we got here? Pauline Lee has just asked, now she's got his sound on, glad you got that sorted, Pauline. Is it similar to microneedling? I've not had microneedling, so
Okay, yeah, Pauline, it is similar in a degree to microneedling. So the tip for the Morpheus 8 is it's a one tip per person. Obviously, it's a completely sterile treatment. The tip has got 24, for the face at least, has got 24 gold-plated pins in the tip. And so what happens is that this is a handpiece for Morpheus Aid. So we use this to actually, we place it on the skin, and then you get a penetration of the tip. I set the depth dependent on your individual assessment and what depth I feel you need to be treated at, but there are some standard settings for that. Certainly the company recommends standard settings, but for people that have got maybe a heavier jowl, we can treat a little bit deeper. But in essence, it is similar to a microneedling type of procedure, but you've got, some people call it microneedling on speed, because you've got the added benefit of the radio frequency, which is completely unique to the in-mode Morpheus Aid, and it's the combination of the microneedling, the radio frequency that help to address those signs of aging, but a similar kind of feeling, but obviously more pins. Whilst I'm talking about the pins for Morpheus 8, the standard facial head has got 24 pins, but there's a tip that you can use particularly for the under eye area and around the periorbital area. There's actually a body tip. So mainly we've talked about face today, but this treatment is really good for body. It's good for abdomens, for buttocks, for thighs, for the underarm area. And what this does is it's got a really unique technology, something called burst. So you can actually use the device to penetrate different levels at the same time. So it's working on the fat layer, it's working on the dermal layer, it can be working on the epidermal layer. So yeah, in essence, Pauline, it's a similar kind of treatment to a microneedling device, but a lot more than that.
Okay, so a few people have asked this question, and Anna has just asked it on the live feed there. Recovery time. What's the sort of recovery time on there? Anna's just, the downtime after the treatment.
Yeah, okay. So downtime after treatment is generally between 6 to 24 hours. For anybody that has a Morpheus 8 treatment, what happens when you come into clinic is I thoroughly cleanse the face, I use the topical local anaesthetic, I'll then cleanse that off the face thoroughly as well. So we've got a really clean base, and what I advise people after that is that they go home, they don't do anything to the face that night. If you feel a need to do anything, you might just splash it with cold water, but nothing else. And really, probably for the next morning, you wouldn't need to do anything. By the evening, most of my patients are on a Abargy, then you can restart some of the Abargy treatments, but not all of them. Retinols and tretinoins that a lot of my patients are on, you need to stop those for 5 days prior to your treatment, and probably around 5 days post-treatment as well. But in terms of downtime, you will, dependent on your reaction, some people will leave the clinic quite red-faced. Generally, it's going to settle within about 6 hours, but I would always prepare people to say, don't do anything special that night, because you might still be red that night. So you can be red for up to 24 hours. But what you've got to think is that this device, to do the job that it's doing, you've got multiple punctures in the surface of the skin. So we don't want any dirt, bacteria, we don't want the dog licking your face, or anything like that. We're dog people. Anything that's going to get bacteria in before these little openings have healed. But generally by the following day you're okay your skin will look pretty much normal. You can sometimes, I personally experienced some almost like it felt almost like sandpaper on the surface of the skin, and it's almost like this very minuscule scabs that you can't see, but that's part of the healing process. Because ultimately with the Morpheus 8, it's the fact that you are having a trauma penetration to your skin that's stimulating your collagen, and that's got to take place to get the results that you're going to get.
Okay, so I've got a few questions coming through now. Is it still me asking? Okay. Just trying to catch up. Okay, so Nancy has a couple of questions, Anna and Pauline, so we'll get round to all of your questions now. So one of the questions, is there any bleeding with the treatment?
So you may get some microscopic bleeding. Yeah, potentially. By the time you leave the clinic, then your face is cleansed and there won't be any active bleeding when you leave the clinic. But yeah, it's not uncommon to get a little bit of bleeding, or a few bleeding points. Also, one of the potential risks, although not that common, but there is a potential risk of bruising, and it depends on you and your vasculature, how close to the surface your vessels are. But there's a potential risk of bruising with the treatment as well. But you've got to bear in mind that within a couple of days you're able to put your makeup on. We always recommend here the use of Jane Airedale 100% mineral makeup, which is something that we stock in clinic. But certainly, yeah, within a couple of days you can, you could reapply your makeup and cover any if there were any small bruises there.
Another question that has come up, and I was actually going to ask a question about preparation before the treatment, if there is anything, but a question that has come up, probably another one I would ask, to be fair. Can you drink alcohol before and after the treatment?
I get asked this question so many times.
It's like when you get antibiotics or something, isn't it? Can I drink?
Lockdown has hit us hard. So in terms of alcohol, what I always advise any of my patients, regardless of the treatment that they're having with me, is that you've got to think that alcohol is something that's metabolised through your liver. Your liver is where all of your clotting takes place. So, and I do see this sometimes in patients that come to me for filler treatments, dermal filler treatments. If they have had more than enough glasses of wine the night before, they may bleed more easily and ultimately bruise more easily. So generally, before and after an aesthetic treatment, the advice is probably the day before, the day after. Avoid alcohol. If you feel a need, a glass isn't going to do an awful lot of, as long as it's not a glass of whiskey, but a glass of wine would be okay. But generally, people who are investing in themselves and making the best of themselves, then the advice would be to not have masses to drink anyway, because it's going to counteract what we're achieving with treatments such as the Morpheus Aid.
I'll just say hi to Karen Neesham, who's just joined
Karen.
us. I'm just trying to see if anyone else has joined us. Hi Claire. Simon. Hi Simon. Okay, so another couple of questions. Is there anything else that you need to consider before and after treatment? We've covered retinol and alcohol. Is there anything else you need to really consider?
So the consent form for the Morpheus Aid is quite comprehensive rather, not apprehensive, comprehensive. Mainly, most people that I see would be suitable candidates for Morpheus Aid, but there are certain conditions or certain things that would probably not make it the best treatment for you. So, for example, if you have a pacemaker, then a radiofrequency treatment isn't suitable. If you have got any facial implants, if we're treating the face, any metal implants or any significant dental implants, then yeah, not probably a treatment I would want to go ahead with. Commonly, people, I generally ask this question when I treat anybody with anything below the eyes, is if they suffer with cold sores. So if you do suffer with cold sores, it doesn't mean that you can't have the treatment. What it does mean is that I, as a nurse prescriber, would prescribe a course of acyclovir tablets prior to the treatment. So because treatments that puncture the skin can actually bring out the cold sores, only if you have the cold sore virus, not if you've never had a cold sore. So I would usually prescribe a course of acyclovir to help to prevent an outbreak following the puncturing of the skin. So I think really, other than that, there are not, if you've got open sores on the face or if you've got an open eczema on the face, then I wouldn't want to go ahead with treatment. I'd want to get that healed up before we'd go ahead, yeah.
So another question, can you have this treatment if you have had fillers?
Yes, you can have the treatment. The advice from InMode is that you would never treat Morpheus8 with Morpheus8 at the same time as fillers. Personally, what my thought is around this is that if somebody's considering a Morpheus8 treatment, then I would recommend that you have the Morpheus8 treatment, because the results you see with Morpheus8 are so good that what I'm thinking is that after your course of Morpheus8, yes, you still might need some fillers to maybe volumise at this point of the cheek, or I do a lot of work on the lower face, which I think actually Morpheus8 will replace some of the filler work that I do in the lower face. But still, sometimes when I assess people in profile, I can see that the line from the nose to the chin is still not what it should be if we're looking at terms of perfection. So it might be that you still might need a little bit of an accentuation of the chin, or maybe a little bit of volumisation of the lips. So what I would advise is that you would have your Morpheus8 treatment to start with, have your course, and then reassess, and we would move on to fillers. But no, you would be fine then to continue with your Morpheus8 on an annual basis. So no, you can still use fillers with Morpheus8.
Good. And of course, there's a few that have asked this question. It's one that we've been asked previously as well, with regards to the cost of the treatment.
The cost of the treatment, okay. So I think a lot of people who have looked at my social media, certainly we've posted the posts around Judy Murray and seen the costs associated with the treatment that Judy Murray had, and dependent on location is dependent on the cost. Obviously, any of my costs in Chesterfield reflect the area that I'm working in. I'm not Harley Street, even though I practice to and beyond, I would say, a Harley Street level of practice. So the cost for the Morpheus8, and this is for treatment from the cheekbones down to the lower face, down the neck. Obviously, the neck treatments have always been historically difficult. I do use Profilo in the neck and get some lovely results with that. Morpheus8, the results I've seen certainly through InMode are phenomenal. So it's a treatment that's actually covering face and neck. Currently there is an introductory offer for the Morpheus8, and that's £500 per face and neck treatment. Once this introductory offer is no longer available, the treatment will be for a face from there down to the neck will be £650, and that is per treatment. So that's the cost of that treatment. I will be looking at costings because I'm aware that some people might just want an under eye treatment and maybe a top lip treatment. Fabulous for the smokers' lines that people suffer from. Then this is a treatment that's phenomenal for that as well. So I'm looking at different packages that I'll put together, but certainly as an introduction, I would be recommending this kind of treatment regime from here down to the neck.
I have a question.
Okay.
We've obviously been talking a lot about the face and the neck.
Yeah.
You touched a little bit on the body. What areas would you look at on the body, and what sort of results are you looking at?
Okay, so the Morpheus Aid is, as I've already said, a unique treatment because of the levels that it can reach to. So it can actually reach down to the adipose tissue, which is your fat layer. And what happens is when it gets down to the adipose layer, the thermal heat that goes through there causes the fat to contract. So I'm sure we can all recognise this, or like the mum tums, or the areas around the hip, or the buttocks, or the thighs, where we might not be quite as happy with them. So what you use with this is it's the body tip. Is a treatment that actually reaches down to the fat layer and contracts it, and then uniquely with this, we can do something called body burst. So initially it'll go down to 5mm and contract the fat all in one shot, and then it comes up as it's leaving the skin, and it actually works on the dermal layer, so it tightens the dermal layer as well. So that's the way that it works, and you can literally use it anywhere on the body. You can use it on the tummy, you can use it on the thighs, the buttocks, you can use it on the underarms.
I think I'll just come and stand in the room. Let's do it.
So it's a platform that can treat so many different things.
Pauline says, book me in. Lindsay West. Hi, Lindsay.
Hi, Lindsay.
Is it not used on the forehead? Sorry if this has been explained already, but is it not used on the forehead?
It is used on the forehead, Lindsay. So, dependent on the issue is dependent on which tip you might use and which level you're going to work at. There's a tip that can also be put on this, which is called the resurfacing tip. The forehead obviously has got it's a much thinner layer. You don't have as much fat there. It's very, very thin. So we use it in a different way on the forehead. But yes, you can use it on the forehead, probably down to 1 to 2mm. And certainly the resurfacing tip, the research that InMode have done around the resurfacing tip, which is working at a much more epidermal layer, so the outer layer of the skin. And it's great for any kind of acne scarring, or any not keloid. If somebody has keloid scarring, then this wouldn't be suitable. But for any kind of scarring of the face, so yes, it can be used on the forehead, and is used on the forehead.
Fab. Emma says that's amazing. Hi, Lauren. So a few people that have joined. The questions have slowed down a little bit. Is there anything else that you wanted to cover with it?
I think I would just like to add that obviously tonight is we're talking about Morpheus Aid, and what I didn't want to do was bombard people with everything else that this platform can do, but that there is something, another treatment that can be used, which is a little less invasive than the Morpheus Aid. It's still a radio frequency treatment. It's quite a pleasant treatment, actually, quite a relaxing treatment, but with phenomenal results, particularly for tightening of the face, for the area under the chin, for the jawline. Again, you can use that anywhere, and that's actually called the former treatment. And this is something that Amy herself, she's currently studying, and it's something that she'll be introducing into her practice in time to come.
Absolutely. And I already love it. So through the training, have been very, very fortunate through training to experience the treatment myself, and I think the results, when you look at the photos, just, it's incredible, isn't it?
It really is.
And it says, and it's actually, to go into Theresa's room and have a treatment that feels nice, it's a real treat. It's really warm. It's actually a very relaxing treatment.
Yeah,
so I will be, once qualified, studying at the moment, but I will be really excited to be able to offer that treatment.
Yeah.
It's just, yeah, very magical machine.
It's a very magical machine.
It is. It's amazing. Yeah, no, we'll look after this one. But yeah, it's a great treatment, and as time goes on, you're going to be letting people know about all of the absolutely incredible things it can do. But it's a lot of information.
Yeah, and it's a lot to take in. It's initially when I took this platform on, it was a lot for me to get my head around. So we will be over coming weeks and months talking more around the treatments that we can offer. And they're all around facial rejuvenation and helping you to look the very best that you can look for yourself.
I think you're a walking, talking advert. Anna says she missed the bit about the special offer because she was getting wine. Is it still available, and what is it? Could you just let them know about that again, please?
Okay.
So
the introductory special offer is a face and neck treatment. So from the face we work from here down and down onto the neck, and the kind of results you can expect to see with this are tightening. You can expect to see that the jowls start to disappear. You get that really nice definition of the jawline. That you get some tautness to the skin. It feels like it did when you were in your 30s, and just generally just picks everything up. But also for the neck, you know, like the crinkly turkey neck that we sometimes will look in the mirror and think, oh my god, what am I going to do about that? It helps to really tighten the neck and just improve the look of the neck, which, you know, we'll see in the past. We've seen celebrities on the television who they've had fantastic faces full of filler, and maybe not so awfully
I saw
done.
one recently, and I don't want to name names now because I don't want to get into trouble, but I was watching a programme with a certain someone that I think everyone knows has had some treatments but actually looks incredible, but I was almost drawn to that.
Yeah, and it is, you know, obviously our skin ages, whether it's the face, the neck, the body, it all ages at the same time. And particularly neck and décolletage, you can use this on the décolletage as well, because of the amount of sun exposure that we get in these areas. We know that the photo damage is done and that the skin will age. So for a treatment, face and neck, the introductory offer is £500 per treatment. Once this introduction is no longer available, the cost of the treatment will be £650 per treatment. And the recommended treatment regime is one treatment every month for 3 months, and then after that it's an annual upkeep of that treatment, so just one treatment a year after that. But there are lots and lots of other things in the clinic that we can offer in between times.
Okay, so a couple of comments here. Zara says, you have been amazing, really informative, a treatment that all your patients will love.
Thanks, Zara. Thank you so much.
Hannah Deplesh?
Oh, hi, Hannah.
Hi, Hannah. Am I saying that right?
Yeah, Deplesh.
You look amazing.
Oh, thank you.
Agree.
Hannah, and it is thanks to you. So Hannah Depledge is Hannah has the Morpheus Aid and has had it for quite a while now, and Hannah is the person I go to personally for my aesthetics because she's so good. Thank you, Hannah.
Shout out.
Shout out to Hannah
for this. And Emma says, so can the resurfacing tip be used all over the face?
Yes, it can. Yeah, it can, just to help with the resurfacing. And I think I personally haven't got the pictures on my page, but certainly Hannah at Eterno Aesthetics has got some really good pictures of somebody that she's treated with acne scarring who's had some resurfacing work with using the Morpheus Aid.
And Lisa says, how long is the offer available for?
So the offer, Emma, where are you? Emma does all of our social media. So actually, I'm not sure what the time limit on the offer is, but it's certainly, because obviously we have been closed for quite a while, so it's certainly going to be on offer up until, where are we now, April? I would say into May.
Get booked in.
Yeah, get booked
I'm hoping I've answered everybody's questions or asked everybody's questions. Let me just go through my list here.
Just to mention for people that might not know an awful lot about the Morpheus Aid. It's got a lot of celebrity endorsements. Judy Murray being a massive one who has had her treatments, and we can see her pictures as the months go on. You can just Google that or look on InMode UK. If you look on Instagram, InMode UK. We also have Amanda Holden, who is an absolute beauty. She looks fantastic. She's a Morpheus 8 user. Kim Kardashian, she has had the body Morpheus 8. Just trying to think, and I don't know, Zara, if you're there. There's a lot of celebrity endorsement for this treatment. Paula Abdul. It's out there within the celebrity field. It is recognised as a platinum treatment.
Pauline would like to know, does she just call the clinic to book? If she wants to book in for that?
Absolutely. Call the clinic, Pauline. We're back in clinic from Wednesday, so we have been picking phone messages up anyway. But otherwise, do that or message us on the page or on Instagram, and we can get you booked in.
And Anna, just to check, do you have to have the 3 treatments to get the £500 price per treatment? So to get the special offer, do you book in for the 3 treatments and then?
You will be assessed ongoing, so dependent on your particular issue is dependent on whether you do actually need the 3 treatments. So as with every treatment in the clinic, you know, it's always a contract between me and the patient. We discuss. We'll initially, when we do a consultation, we'll talk about what your aims are, what your requirements are, and I always revisit each treatment. Okay, are you where you are happy? In my opinion, we could do this, but equally, if you're happy with where we're at, then we can leave it at that. So I would say for anybody, certainly in the 40s, 50s, 60s, then you may need the 3 treatments. So yeah. I think I'm not sure if that answers the question, Anna, properly.
Well, yeah, I guess it's judged on each individual.
It's each individual, but I would say for anybody who is thinking about embarking on getting the best version of themselves, helping themselves to look the best that they can look, then they would probably think that they would be going towards the 3 treatments.
When we talk about celebrities, oh, actually I missed one there. I think Lindsay was just saying, is the resurfacing the same price? Have that been priced yet?
Yes,
the same price.
Yeah, it would be the same price, Lindsay. The resurfacing would be because I would use the treatment all over the face and the neck as well. So yeah, the same price.
Zara just added a couple more selects to the list.
Thank you, Zara.
All right, Duncan from Blue.
Duncan.
And then Tragedy, Faye from Steps. Never doing that again.
Not the Bee Gees. Thank God.
No. I don't say now that that's not going to be a good advert, but anyway.
No.
Hannah Ruth says, no questions, but you both look beautiful. Sending love from España.
Oh,
thank you, Hannah. Liesel says, my 2 faves. We know.
We love you, Liesel.
We love you. And Zara says, for best results, a course of 3 is recommended, of course.
Yeah, of course, yeah.
Any other questions from anybody? Hi, Judith and Adam.
Oh, hi, Judith and Adam. Hello.
Why did I just forget Adam's name? We quizzed all last summer. Yeah, so we've got a few people that are just joining to say hello. But I'm hoping that we've answered everybody's questions.
Yeah. If anybody has any more questions, then please just drop us a message on Facebook or Instagram, or give us a call at the clinic as from next week, and we'll answer your questions. Usually what I like to do anyway is to carry out a consultation prior to a treatment. So even if you wanted to book in for a consultation, come along, have a chat, have a look at whether I feel that you are an appropriate patient for Morpheus 8, or whether there's something else that I feel might help you. But yeah, just We love people. We can't wait to see people. Contact us.
Just to see people walking into the clinic again will just be so amazing.
We're going to be happy. We're going to be happy.
And I'm just going to add that I've been ID'd for alcohol twice this week. So if that's not a reason, not I haven't drunk twice this week, but if that's not a reason to have this treatment, then I don't know what.
And I think what we will do is, so Amy hasn't had the Morpheus Aid, but she has had formal treatments. And I think what we'll do is we'll probably post Amy's before and afters, because the difference that you can see is fairly significant, and she's not even completed her course of treatment yet.
Yeah. Amazing. Nancy, great presentation, girls. Lots of love, Nancy.
Thanks,
Thank you, Nancy.
Nan. See you soon.
I think that's it. Gosh, that confused me. I think Emma is on the social media and has just answered a question that came up, so that just threw me off a little bit. But I think she's just put on there, to answer the question, read time limit on special offers. There's a limit on numbers we can offer, but it will be running until at least the end of April or when they've all been booked.
Yeah.
So if you are interested, book before they're all taken. Basically, I think that's what
Emma.
Thanks, Emma, for confusing me.
Thank you, Emma. Where would I be without you?
Yeah, any of us. Is that it, everybody? Any more questions? It's been lovely to have everyone join us.
Oh, thank you, everybody. Thanks for joining us. It's the first live that I've done, and
you've done brilliant.
It's not nearly as scary as I thought it would be.
You have a lot of information up there, don't you?
Amy's the queen of lives. Thanks for your help and support. Social distance, of course.
Of course. I've got just a couple of extra ones that have just come in there. Helen, I'm booked in for construction in May. As earliest I could get. Does she still get the introduction offer? So she's not consultation. I'm thinking not construction, maybe.
Absolutely, Helen. No,
Can she still have the offer because she couldn't get in till May?
Yeah, that's fine. The offer still stands. I am aware that the diary is full, and there aren't actually any April appointments left now. So no, the offer will still stand, Helen. That's fine.
And I think Lisa means by her question, if you are having if it's around, Helen, we got that it wasn't construction. I'm sure you don't need full construction consultation. Yeah. She's put lol. So, Lisa, COVID vaccine, can treatment happen at the same time?
Okay, so in terms of the COVID vaccine, generally what I am advising, I can't think that there would be any contraindications. However, I would recommend, just coming from my nursing background, I would recommend that you are leaving at least a week after your COVID vaccine before you have some kind of treatment, because basically what we are doing with this is creating an inflammatory response, and I know I'm still working in general practice as an advanced nurse practitioner, and I know recently, having looked at some patients' blood results, that following a COVID injection your inflammatory markers can elevate. So I would want to just be sure that everything is settled after your COVID vaccine. So yeah, I'd want at least a 7-day period post injection. I wouldn't want you to have your injection and then come to see me the same day or within that week.
And then Samantha Deacon, yes, the video will be on replay, so we'll save it to the Goldsmith Clinic Facebook page, and it will be available to watch anytime.
Yeah, absolutely. Yeah.
And if you want to watch us again, just for fun, then feel free. Okay, I've told Helen to stop it because she thinks she does need construction, which I'm sure she doesn't.
I'm sure she does.
And I think that might be all of the questions answered.
Okay.
So
wonderful. Thanks for joining us. It's been a lovely Friday night.
It has, hasn't it? Yeah. If it was next Friday, we'd definitely go to the pub now and sit outside, wouldn't we? But it's not. But yeah, thank you for joining us. It's been lovely.
Thank you. Thanks. Hope to see you all soon. And take care. Have a good weekend.
Bye.